I'm really hoping to have a great school year and have it as normal as possible for everyone's sake. In light of the public health department posting numbers again, I'm looking for transparency and honesty as we move through the school year. As a parent, I always want to have a choice. I've homeschooled, we've sent our kid to private school, and now we're in the public school system. And I want to have a choice around her medical care as well. So if masks are mandated again, then I want to know that the reason for doing so makes sense based on honest data. As a community, we should come together and determine what those parameters are that make these mandates reasonable. If masks are required again at some point, which masks? Which masks have been proven to prevent the spread of SARS-CoV-2? N95 masks, hospital masks, homemade masks, a mask that matches your outfit? Which masks actually work, and will you be providing these masks so that we know that everyone has a clean mask that works each school day? Once we figure out which masks, how are we going to determine that masks are needed in school and on the bus? Are we going to use case numbers, hospitalizations, or deaths as the reasons for mandating restrictions? If we use case numbers, which is currently being used, are we using case numbers within the school system, or are we going to include cases coming from nursing homes or other long care facilities as well? If we use case numbers, are the cases within the school system symptomatic? Do they have a fever? Have they been to a medical doctor? What tests are we going to use to determine that they were positive? The take-home test you can get from the library, or a test performed by a professional? Are the tests being used to determine whether the virus is actual SARS-CoV-2, some variant, the flu, or just a common cold? How accurate are the tests being used? How many cycles are they running on the samples? Is the virus detected alive, meaning that they are truly infected? Or is the virus dead because their God-given immune system killed it? To go off cases is really difficult because a case does not mean that the person is infected. In order to transmit an infection, you must be infected. You cannot infect someone with a dead virus. If the tests being used are cycled too many times, it can pick up a dead virus and be considered a case. It is not. So what I propose is, as a community, we come together with a plan so we're not waiting for the ball to drop. I believe that there was an in-house case count last year, so using something along those lines to help keep track of what's going on within the school system. It doesn't have to be emailed to us every time someone tests positive, but an internal record, so if restrictions come back, we have transparent and honest data. So if we keep masks optional in school and on the bus, we're good. Everyone has a choice. But I don't want to wake up one day during cold and flu season and find out that the rules have changed. I want to know, okay, if a pandemic breaks out in our school, which we have determined by X, Y, and Z parameters, the mask will be required for a short period of time. I think more people will be relaxed, enjoy the school year if we have a plan. So let's come up with a plan that works for our community. Thanks.